Hi everyone, Dr. Kokoma here. We're now in week 6, module 6 of the course. And this week we're talking about multi-stress families and diagnosis related to not only adults, but adults living within a family structure. There's plenty of reading this week and a video to help you gain some more information. In particular, one of the diagnoses that we're taking a look at is schizophrenia. And psychotic disorders. And this really pertains to not so much a difference in mood as it does in a difference of thought. How one makes judgments, how one thinks about what they're about to see, say, or do. So keep that in mind. It's not a disruption so much of mood as it is a disruption of thought, pretty much with our executive functions. Schizophrenia has what we call negative and positive factors. The positive factors would be the presence of delusions and hallucinations, and these hallucinations can be of any of our senses: visual, auditory, olfactory, taste, and touch. The negative symptoms would be the lack of interest and motivation, the apathy, the lack of social connections, and those together will give us a better picture of possibly fitting into this diagnostic category. We have a full class discussion this week with a case. I think the man's name is Paul, and I really want you to pay attention to the presenting symptoms in the first paragraph or so of that case. In particular, it does mention suicide, and I want you to consider if this now, with these types of serious symptoms, does he remain with the current diagnosis of dysthymia. There's a small group discussion board where there are 3 cases, again, where you get to exercise some of your thoughts about a possible diagnosis given the presenting symptoms. And I know with all of these cases there's probably much more information that we would like to have, but keep in mind I am just looking to see that you get into the DSM-5 with the presenting symptoms that are given, and to try and determine whether it's this diagnosis or that diagnosis. Remember about the differential diagnosis. What is ruled in and what is ruled out leaves us with this particular category. You also in your groups are going to be discussing and giving feedback to each other on your paper. And so it should be a pretty active week, and I look forward to seeing you all online.